Hello, kidney warriors. James here from Dadvice TV, your online kidney health coach. And this is another episode of Dadvice TV Live. Now, this is an extremely special episode because we have someone here for their very first, but definitely not their last time on Dadvice TV, a new nephrologist. Woo! A kidney expert here to share some great information to help us. Now, today we're going to be talking about, it's kind of technical, your microbiome, your gut, and the connection between your gut and your kidney health. Now, as most of you know, my renal dietitian recommended that I take a probiotic called Renadyl, and I have been taking that for years now. It is part of all of the things that I do to help live the best I can while I happen to have really bad kidneys. So we're going to talk about what is the microbiome, the connection with kidney disease, what is a probiotic, even what is a prebiotic, and we're going to talk about Renadyl. So sit back, get ready. If you have questions, remember, you can always type them in the comments, and we're going to try to answer as many of them as we can during this conversation. So let's go ahead and let's get to our new guest. This is his very first time here on Dadvice TV. He is a hoot. And let me tell you guys, he knows Dr. Rowe, and he's a lot like Dr. Rowe, so you're all going to love him. Please welcome Dr. Richard Johnson, which is also known as Dr. Rick. Hey, Dr. Rick, how you doing?
Fantastic, James. It's great to be on your bigger than life show. You are quite the adventurer here. So yes, I'm very happy to be on your show, and I'm very happy to talk about kidney disease. I'm a physician, nephrologist, professor at the University of Colorado. I've been studying kidney disease and treating patients with kidney disease for too long to tell you. And I'm also an editor of our textbook on kidney disease that's used throughout the world. And it's the main clinical textbook, and we're in the 8th edition. And so anyway, I'm very delighted to be on the show and to learn from you, James. I'm going to learn from you too. I'm just absolutely certain about it.
Yeah, and everyone out there, I told Dr. Rick, I said, hey, I've got a pretty wild introduction, a way that I always start every video. So be prepared. Did it surprise
Kidney
you,
warriors,
Dr.
I
Rick?
love it. I love it. Kidney warriors. Here we go.
Yep. And we've got people here, like here's Wisconsin grandma saying, hey, Dadvice, hey there. And Dr. Rick, love all the info. We got someone watching here in Barbados. And we've already got questions coming in about Renadyl. So let's go ahead, and I've got a list of questions, Doc, to help educate our audience as well as me. So let's start at the beginning. What is the gut microbiome, and why is it important?
Well, okay. So, first off, the gut microbiome refers to the bacteria that live in our gut. And although we think we are just ourselves, we actually carry with us millions and billions of bacteria. And these bacteria live in our gut. And when we eat, they metabolize some of the food, and they do their own things. And for years, we thought that they were kind of there, but not doing much. But there's some very interesting breakthroughs that kind of told us the microbiome is a lot more important than we ever thought of. We've just thought of, oh, you got the bacteria. Yeah, you can sometimes get diarrhea from the wrong bacteria. Montezuma's revenge. Everyone knows that one, right? You go to Mexico and you get diarrhea. That's due to a bacteria. And there's cholera and diseases like that. And so we've thought of the gut as, carrying these bacteria, and sometimes they can be bad and you can get infections. We never thought of them as being good. But you want to know something, James? We learned from bears.
Oh,
yeah, yeah, I got you. I got you. You weren't expecting me to say that to you.
I was not expecting. See, I learn every time. That's why I love having experts on the show because I'm getting an education and I'm not racking up student debt doing it.
There you go. So it turns out that a lot of bears, like black bears and brown bears, grizzly bears, hibernate. Not all bears hibernate. Polar bears don't hibernate, but some bears hibernate. And when they hibernate, they quit peeing. They actually completely shut down their kidneys for like 4 to 6 months.
Wow.
Now, okay, now what if we shut down your kidneys for 6 months, you'd be on dialysis or you'd be dead, right?
Exactly.
But these guys they hibernate, they drop their body temperature, they drop their metabolism, and they don't pee for 6 months, 4 months, 4 to 6 months, and so you would expect with the kidneys not excreting. I, it's sort of interesting. There's a very tiny amount that's excreted, but they reabsorb the urine in their bladder. So to be technically correct, they do make a little bit of urine, but basically there's nothing coming out. And
Mm-hmm.
so normally, we measure kidney function. We measure the amount of urea and other things in the blood. And when you don't pee, your urea goes up. Your kidney function tests show that your kidneys aren't working. But you know what the bear does? The
No.
bear's urea doesn't go up. It
Huh.
goes down. It goes down. It goes down. How can it go
Wow.
down? And it turns out they figured out that the urea was getting into the gut, and there were these good bacteria. And these good bacteria break up the urea and turn it into ammonia and other things that's absorbed to help keep the protein status high. And the creatinine does go up a little bit, but basically the gut of the bear when you hibernate is making good things to help you so that you can get through the entire winter without going into kidney failure. And what's interesting is they even bear a child, they bear a baby. They can be pregnant during hibernation. So then the
Wow.
baby bears, yeah. And so that's pretty good because you have to maintain pretty good function to carry a fetus, to carry a baby. So
Yeah.
these bears were teaching us something. We knew a long time ago that back in the 1960s, we knew that there was something special about the microbiome whereby it can do some things that we never would think of. We think of it as a bad. We were taught it was a bad guy. You get bloody diarrhea, you get E. coli 0157, the Jack in the Box epidemics and all that
Mm-hmm.
stuff. But actually, the bacteria can be good. They can be really good. And beginning around 20 years ago, people started realizing that, we have friends in our gut. When you walk around, you got a million friends in there and you got a million bad guys in there too. And so, and so we tried to figure out what is it about the microbiome that it does that's good, and what is it about the microbiome that does bad things.
Mm-hmm.
And we found that in people with kidney disease, when you get chronic kidney disease, you actually get kind of bad bacteria in your gut. They're making bad things.
Mm.
And there's a substance called TMAO, which is a trimethylamine oxide or something like that. It's
Oh,
hard to
don't make
remember.
me learn that word.
Hey, I'm going to
I'll
test
stick
you
with the
later.
I'll stick with the abbreviation.
Yeah,
TMAO.
TMAO. That's it. And what they found is that TMAO, it when it goes up, it's made by the bacteria, and when it gets up in the blood, it increases the risk for heart disease and kidney disease and all kinds of stressful things. And a bear in the wild doesn't make too much, but if you put a bear in a zoo, they will make it. But when they hibernate, it goes all away. It goes away. Hibernating
Mm-hmm.
bears like to make good things. And there's a substance called betaine. Sounds like I mean, what it is it's a good guy. It kind of blocks a thing called oxidative stress. It's like an antioxidant. You probably have heard these phrases,
Yep.
and it goes up in the gut of the bear during hibernation. We actually did studies on these guys, and we were nice to them. James, we were nice to those bears. No bear got hurt,
There you go.
but we did test their poop. So that's bear poop. It's not really a thing that a lot of kidney doctors study, but I did. So anyway, but there are good things in the microbiome. And what we've learned is that there's also this very peculiar problem of the microbiome. And that is if the microbiome gets a little sick, if it's kind of like in chronic kidney disease, the microbiome isn't so healthy. What happens is we get a thing called, some people call it leaky gut.
Yep.
But what it is the lining, the internal lining of the intestines, it gets disrupted a little bit. And things, normally the way the gut's supposed to be is, you eat all this stuff, right? You got food, you got stuff that you want to absorb, and there's stuff you don't want to absorb, and it comes out in the poop.
Mm-hmm. Yep.
And you really, you want to absorb calories and protein and fat and carbohydrates, but you don't want to absorb things that you're going to react to. And so the lining of the gut is a barrier to help prevent the bad stuff from getting across. And when you get a leaky gut, these bad things can get across. And one way is like, I'm kind of an expert on sugar. Maybe some of you listening know this. And if you drink a lot of sugary beverages, the sugar causes the leak in the intestine, and you can absorb things. And so, for example, little children who are being given large amounts of fruit juice, which has a lot of sugar in it, they can get a leaky gut. And then when they eat peanuts or they eat shrimp or they eat some of the proteins that normally would be degraded in the gut actually can escape across the gut barrier into the blood. And there they can induce an allergic reaction. And, this big epidemics of food allergies is related to a leaky gut, which is related to a sick microbiome. So
makes sense.
So what we've learned is that the gut is really, it's like the secret mystery, because we are used to looking at organ function, and doctors see you and they go, well, we'll check your kidney function, we're going to check your lungs, we're going to check your heart. When they check the gut, they're not thinking of the bacteria that live there. They're thinking of the housing. They're thinking of the gut itself. But there's another player, and those guys that live in the gut make a difference. About 20 years ago, no, go ahead. I'm sorry.
I was going to say, how do they test the gut? Because I don't think I've ever had mine tested. Not that I know of. I've had a lot of tests.
Well, you want to know something? There's all kinds of sophisticated tests, and some of them are like outrageously funny. So, like for example, there are ways you can just test culture the gut, culture the poop. I mean, so It's not particularly glamorous, but you can culture it and you can grow thousands of bacteria out there. But they use molecular biology, and they can amplify. They can look for the DNA and the RNA, but especially the DNA that can identify one type of bacteria versus another. And what's outrageous about it is they can actually, everyone has a certain type of microbiome, and you can kind of get typed almost like a fingerprint. And even when you like go to the bathroom and and you just sit there, there's bacteria that also kind of live on the outside of you, not necessarily in the poop, and they can
Yep.
actually they can identify which stall you went to. I mean, these guys can
Wow.
do. Yes, it's outrageous. It's outrageous. But anyway, but the bottom line is everybody has kind of their own signature of what they have, and it can be modified. So if you're on a Western diet, with lots of fat and French fries and
Hmm.
hamburgers and sugar and all the good stuff, right? But when you eat all that stuff, it creates a set type of bacteria, and they that like that kind of food, and they adapt to it, and they actually can play a role in driving obesity. So the bacteria, that like the Western diet, the sugary beverages and so forth,
Yep.
well, can actually produce stuff that can actually uh, add to the risk for obesity. And there were studies done years ago where they would transfer the bacteria from like fat mice into lean mice, and lean mice into fat mice, and you can change the phenotype, or you can make a lean mouse gain weight. They won't become as fat as a regular fat mouse, but
Hmm.
you can show an effect from the bacteria. So
Wow.
what happened was, in this field of kidney disease, you know, I tell you, I've been the editor of our textbook. We don't talk about the microbiome. For years, we didn't talk about the microbiome because it wasn't the focus. We were looking at, you know, what's going on in the kidneys, what's going
Hmm.
on in the organs that affect the kidneys, and we weren't thinking of these little guys in the gut having a role. But what's happened in the last years, and we should have learned from the bear, is that the gut microbiome is pretty important. And so what we now know is that the microbiome, here are some major points of what they do. One, the microbiome can help metabolize things like urea, creatinine. They can actually break it down. You can give, an animal bacteria that degrade creatinine,
Hmm.
and it can bring your creatinine down. It can bring your BUN down. Now, that doesn't mean that it's actually improving the kidney function, because it's getting rid of the things that the kidney normally gets rid of. So the
Yep.
kidney may just be as sick as it was before, but it's going to get rid of stuff that could cause symptoms. So,
Yeah, I like
if
to
you're
think of it kind of as you're eating this food that normally gets absorbed to your blood, and your kidney's got to work really hard to try to, remove
yeah,
that stuff that's not supposed to be there, that, it wants to manage. But these are like, I think of, they're like little Pac-Mans in your
yeah, yeah,
gut,
yeah.
eating up some of this stuff so that it doesn't get absorbed. And then it takes the poop train out into the toilet, which reduces some
Pac-Man
of
on
the
the poop train. I
burden.
like it.
Yeah, it reduces some of the burden on your kidneys so they can better keep up with you.
Yeah.
That's the way I
Now
like to
that,
think about it.
so that's the first one,
Yep.
and that's good, right? And that helps you. I'm going to think of that Pac-Man. I
Yeah,
love
I
Pac-Man.
just picture it in there eating that
I,
stuff up.
I'm in that,
And
from that generation. Yeah.
yeah.
Anyway, yes, yes. So yes, it can be a Pac-Man, but there's a second thing, which is the secret weapon. And the
Hmm.
secret weapon is that years ago, it was discovered that there's so many things that drive kidney disease. We know it, right? Diabetes, high blood sugar, that's a big one. Another one is high blood pressure.
Hmm.
There's all these things that physicians look for. If you go see a kidney doctor, he's going to say, "What's your blood pressure doing?" Because high blood pressure is bad for the kidneys.
Yep.
They're going to make sure you're not diabetic, and if you are, he's going to make sure the blood sugar is under control. Because we know that high swings in blood sugar are bad for the kidneys, right? There are all
Yep.
these things we test for, but there's one thing that we didn't know about until the last 10 years,
And what
and
is
that
that?
is, can you guess?
Well, it's got to be related to the gut. So it's got to be some kind of bacteria that helps.
Yeah, no, actually,
No.
you're right. You're right, and you're right. But it's inflammation. So,
Ah.
what we used to think that inflammation is, I've got a fever of 102, my white blood cell count is elevated, I've got a red knee from acute gout in my arthritis. I'm having pain, inflammation, fever. Inflammation was akin to having a fever or an infection, or I've got a virus and my temp's 102. That's inflammation, right? But there's another type of inflammation that we started realizing, and it's one where the inflammation is subtle. It's mild. It's so mild we don't even know it.
Mm.
We don't have fever. Maybe it's 99.2 or something, but we don't think of it as a fever. But we can look for markers of inflammation, and they're in the blood. And one of them is called C-reactive protein, CRP. That's not too hard to remember, CRP. And doctors will measure this on you. So if you've got kidney disease, you can go ahead and ask for a test of whether or not you have inflammation present. And the CRP is a pretty good test. And if it's elevated, it means that there's some kind of low-grade inflammation. It may be so subtle you would never guess it. Or you might actually kind of not feel very good. Sometimes it can be associated with just not sleeping well and not feeling well. But oftentimes there's no symptoms. And a guy named Paul Ritker, who's a very famous cardiologist, realized many years ago that when you measure CRP, that if it's elevated, that it carries an increased risk for heart disease, independent of
Hmm.
blood pressure, independent of cholesterol, independent of glucose. And guess what? It carries an a true risk for kidney disease to get worse. Inflammation is kind of a bad actor that causes low grade damage everywhere,
Aha.
in the brain, in the heart, in the kidney, everywhere. And guess what? If you got a leaky gut, bad things get across, and it causes inflammation. So an elevated and an inflammation is often linked with a leaky gut and with a bad bacteria in the gut, and it's very tightly linked. You can have inflammation from other things too, right? You can have an
Yep.
infection, but the gut, when there's bad guys in the gut and they're kind of screwing up the barrier, things like little bacterial products get across. They stimulate an inflammatory response. It's so subtle you may not know it, and over time that actually causes kidney disease, real kidney disease.
Aha.
So when you fix the gut,
Now,
you
how do
can
you fix
actually,
the gut?
well, with probiotics, with good diet. First step is good diet,
Yep.
but not all of us can avoid that cheeseburger. Not all of us can avoid. We're all guilty.
Everyone will tell you I used to be thin,
Yes,
and then
everyone
as my
starts off
kidneys
that
got
way.
better, I got more comfortable eating things I shouldn't.
Yes, yes. So you're not alone. You're guilty. I'm guilty. Everyone can be guilty a little bit. We try, and actually, it's really important to try to eat a healthy diet, but you can't always do it. When my son gets when he would get a birthday cake, I was going to eat a slice. It's his birthday. You
Yeah.
know exactly. So anyway, but the bottom line is, uh, the first thing that the gut, good bacteria in the gut can do is they can chew up these guys, the Pac-Man. But that doesn't make the kidney better. That just makes the symptoms better.
Hmm.
The second thing it can do is it can block inflammation. and that will actually make the kidneys better. That can make kidney function, true kidney function, improve. A third thing it can do is it can produce stuff that is healthy, like antioxidants, like that thing called betaine, which is a good guy. And it
Uh-huh.
and of course it can make bad guys too. But in terms of the things that we're looking for, the dream is to have bacteria that are favorable for you. They try to keep your weight down, they try to keep your blood pressure down, they try to help your kidney function, they try to reduce inflammation. And that kind of led to this world of trying to make prebiotics and probiotics and things that could alter the microbiome. And that's where this guy Rangan came in.
Mm-hmm.
So there's a gentleman named Rangan. He was a tall, pretty cool a man from India who was a microbiologist, and he had this dream, and his dream was to try to develop a probiotic for kidney disease. I never really knew why he picked kidney disease, but there's probably a story behind it. But he would come to
We
all the,
all know someone who has kidney disease,
yes,
and
probably
maybe
had,
he
yeah,
had someone in his life that had it and he wanted
yes,
to do something to try to help him.
yes. So what he would do is, he started making these different, studying different kinds of bacteria, and he would look to see which ones could break up and eat urea or eat uric acid or eat creatinine. And he also tried to look at ones that could reduce the production of inflammation markers and things that cause inflammation. And so he was working every year on this, and he would always come to the national meetings. And I've been a leader in kidney disease in the sense of I've been going for many years, and I do a lot of research, and so uh, I know a lot of people, and I would always go find them because everyone's working on making drugs to try to help kidney disease, or the focus is on pharmaceuticals,
Mm-hmm.
and we need more focus on diet, uh, what's good to drink and not to drink, and also this idea of going after the microbiome was really his idea. He really was the leader on it. And so I would always go visit with him at the national meeting, and he would, was always at his little table and his little setup where he would show what he's doing. And over the years, I actually tested his probiotics in animal models of kidney disease, and
Mm-hmm.
we had this one model where we raise uric acid in them, and uric acid is this substance that's retained by the kidney. So when you go get kidney failure or kidney disease, your uric acid can go up, and when it goes up, it can cause a disease called gout, where
Oh,
it
I know
forms.
gout.
Have you had gout?
Yes, I take medication for uric acid. Mine can get extremely high.
Yes. Well, so there's a few things that make uric acid go up, and the one that's classic is alcohol. But kidney
None of that
disease
here.
isn't. Okay, that's not you, but it is a common one. Heavy drinkers can get gout, but you can also get it just from kidney disease because the kidneys play a big role in getting rid of uric acid. So about 2/3 of the uric acid we make is excreted by the kidney, and 1/3 is excreted by the gut. So the gut
Mm.
has a role in getting rid of uric acid. And the foods that raise uric acid include sugar and what we call purines. It's basically shellfish is like the really the leader. Lobster, crab, shrimp, all the things that we would love to eat can actually raise our uric acid, and lots of red meat can do it too. Anyway, so we had a model of kidney disease in animals where they have a high uric acid and they have bad kidney function. They get high blood pressure. And Rangan gave me his probiotic, which later turned into Renadyl, right? But
Yep.
when he gave it to me, I fed it to these little mice that were at high risk for getting gout themselves, and we were able to actually slow their kidney disease, lower their blood pressure, and lower their uric acid. And the way it worked was these bacteria. Normally, there are bacteria in our gut that get rid of uric acid. About 1/3 of our uric acid is gotten rid of by these bacteria. So if you take additional of those bacteria, you can actually lower your uric acid. And we could do that different ways in these animals. And that was when I said, okay, Rangan, you've got something. We need to take it to the clinic. Let's do some clinical trials. I'm willing to be a researcher for you and try to set up clinical trials. But it turned out that he ended up doing clinical trials with other people, but he had some very, very, very promising studies. The biggest study involved almost 600 people, and he wasn't able to. Unfortunately, he got sick and passed away during the trial, so he never was able to finish it. But when they stopped the trial, they could see a statistical improvement occurring in the people who were getting the Renadyl. And it was a true improvement in kidney function. It wasn't just the eating of the markers. It wasn't just the Pac-Man effect, because he showed it across the board for 4 different kidney markers. And so that told me that, he was on the right track. It wasn't a huge effect, but it was only a 6-month study. And most studies, to really see a significant effect, you have to go out, 2-3 years. And they ran out of funding. He was funding it out of his own pocket, I believe.
Wow. Now,
he's a real hero.
The bacteria that's in there, just to help clarify it for people that are watching, the dollar store sells probiotics. You go to Walmart, there's a bunch of probiotics. Do they all work the same, or do I need to take specific strains to get these effects?
So there in general, there's one bacteria that is like the king. It's the one that I love. It's called lactobacillus, and it's present in yogurt, and it's present in almost every good probiotic carries lactobacillus. I love lactobacillus, and actually, I found out that I had a great uncle who was one of the first guys to study lactobacillus when he was at Yale back in the 1920s. And so I know I love that lactobacillus, but it's the king, okay? It's the one that really is good, and there are a lot of bad ones, but it isn't so simple as that. You just go out and eat yogurt and you're fine. What Rangan did was, so people make probiotics for all kinds of things, and so there's probiotics there, but Rangan tailored it for the kidney. So he actually looked at what degraded creatinine and what degraded uric acid, and what degraded urea, and he made a little group of bacteria. And like the one that I'm trying to remember which one, there's some of them were kind of rare. They weren't all the same. They weren't all lactobacillus. There's another group called bifidobacterium. That's another really good guy. So a lot of good probiotics have lactobacillus bifidobacterium. And honestly, if you take a probiotic, probably it's going to have some of these good guys in there. It's going to be great, but if you really want to tailor it for the kidney, what Rangan did was that. So it's a little, I would say it would be It would be good to run a trial, one versus the other, and maybe someday there will be. But for sure, he has some bacteria in there that are fairly specific for certain things.
Yeah, and when I was first diagnosed with kidney disease, kidney failure, um, my dietitian, the second dietitian, my first one, it didn't go too well. But my second dietitian recommended this to me, talked to my doctor about it. My nephrologist was actually familiar with it. And they said, yeah, take this. And it has been part of my normal, I guess, treatment strategy since shortly after being diagnosed. And, to me, in my mind, those strains are part of what has helped me. I can't say exactly how much it did, but I did a number of things all to help me try to eliminate my symptoms, which I've gotten rid of all of them, which is fantastic.
Well, that is
Got my
fabulous.
energy back. I
I
if
don't
you
know. You look
watch
like you're a low energy guy.
yeah, I'll tell you, if you watch my first video, you would be shocked. I am low energy in it, and my eyes were so sunken in. I look like an actor from The Walking Dead who played a zombie. It was weird. It's like, whoa. But, I like it as part of my treatment because it's easy. I just take, two of the tablets every day. With my other stuff, I try to eat a high fiber diet. That's one
Good.
area where I really need to work harder on. Those drive-through things are pretty low in the fiber, so I got to get back
Yeah.
to eating some high fiber stuff. But I've been extremely happy with it. It doesn't upset my stomach. I don't have any side effects or anything like that, and I've been
Yeah.
extremely happy. And you've taught me so much today about it, making me even more excited about it.
Yeah, you can feel like you're one of those healthy bears, you know.
Yeah.
But getting back, I should say, that it's not FDA approved as a treatment. It's not meant to be a treatment. It's meant to be a supplement. It's meant to be kind of to help make you feel a little better, to help. It hasn't been proven to have huge effects on kidney function, but it might if you take it out longer. I mean, it was definitely having a significant effect at 6 months. But anyway, so I just want to say it's not like you need to absolutely go on this, but if you are inclined, you may want to give it a try
Mhm.
and see how you personally feel, and get your creatinine and BUN and stuff like that measured when you started, and 3 months later, when you see your doc again, get checked and see if the things are improving.
Yeah, I'll tell
If
you,
they're
it's
not
every
improving and you're not feeling better, stop it.
yeah, I'll tell you, everyone here on the call who's not on dialysis shares the same fear I have, and that is going on dialysis. So anything that has any evidence that it can help, even if it's just a little, to me that's a winner. Because all these little things like walking more, getting my blood pressure in control, all these things add up together. And I would hate, or let me back up a little. When I was first told about I might need to go on dialysis, one of the things I did is I took a tour of dialysis, a center, and I got to talk to a few people there. And every single one of them had mentioned how they wish they would have, especially those that were diabetic, they wish they would have done things to try to improve because life on dialysis is not fun. And I kind of saw it as, hey, it's worth it for me if this is just one more little thing that could give me the chance to delay the need for dialysis. So that's kind of how I look at it.
Yeah, I like that. And I have my own personal story. I've never shared this on a podcast or anything, but um, when I was uh, when I turned 60, I was in clinic and working at the hospital and in the outpatient clinic, and I wasn't feeling very good, and I had been not feeling well for about several weeks. And I'd been taking a medicine for reflux. It's called omeprazole, and it's a very common drug. But omeprazole has a very rare side effect, and it can rarely cause kidney problems. Anyway, I at the time I just wasn't feeling well. I was, I felt like I was inflamed. And so I went down and had my own blood drawn, I ordered my own blood test. And then I went back to clinic, and I'm seeing patients. And between a patient, I just go to the computer and I opened up to see my labs. And my God, my creatinine was like 4.6. And, it had been normal. And here it was, almost to the point of dialysis. I had a higher creatinine than all the patients I was seeing in my clinic that afternoon. So I kind of, I look at the urine of every patient to kind of make sure what's going on, because it's kind of the old style physician, to kind of really understand what's going on with the kidney. So I put my own, I snuck in, asked the nurse for a little tube, and she knew. And I came back in and I put it on the stage of the microscope, and I looked through and I go, oh God, I have white cells. I have all this stuff. So it looked pretty bad to me. So we had another kidney doctor working the clinic with me. And I said, hey, Josh, do you want to just take a look at this? And he goes, oh, this patient's really got this bad disease.
Because he didn't know it was yours.
You didn't know it was me. And the nurse knew it. And so anyway, I got to the clinic, and then I called our top the guy who does kidney biopsies. And I used to do a lot of them, but at that point, when I was 60, I passed it to Isaac, and I called him and I said, hey, Isaac, I've got a problem. I need a kidney biopsy, and I need it done on me. And so within 24 hours, this is the thing, when you are a kidney doctor, you can kind of get the fast line. I kind of feel guilty about that, but I had a kidney biopsy the next day. I had this really bad kidney disease. It was from this medication. I stopped the medicine and I went on steroids, and I was able to avoid dialysis, and my kidney functions, back to pretty normal now.
So pretty much was an AKI from the medication.
It was but it took 6 months to recover. So it was a longer time to recover because it was a really bad inflammation. But I learned a few things. I learned what it's like to have kidney disease, what it's like to have a kidney biopsy. I learned a lot of stuff that I was doing to others that I was, so it made me, I think it made me a better doctor, to be honest. And so, I don't really wish it on anyone to have that experience, but I do feel very close to my patients, and I know what it's like. So when you say, you go to the dialysis unit and you look talk to the patients and you think this could be me, I think the same thing when I go to the dialysis patients. I go, you're not so different from me. I could be in that chair. And so anyway, the bottom line is we all want to do the right things. And being on your show, I do want to talk a little bit about diet too. I just want to point out that, our work shows that diet and exercise are really, really important. Going for walks every day, drinking a lot of water, I would say 6 glasses of water.
Hey.
Yeah, I have a low sugar drink. I would recommend trying to cut back on sugar and high fructose corn syrup. That's bad for the kidneys. I would still eat a good protein diet, but I wouldn't eat a huge amount of protein, like a lot of meat, but I would eat a fair amount of meat. I would not go on a low protein diet. And, I can discuss this. I'm sure, Dr. Rowe has talked to you about this, or Roz, I guess. Is it Dr. Roz or Rose?
Dr. Rowe. Yeah, he goes by Rowe. Okay. Instead of we don't have to say
Rowe the bro. Rowe the bro. I'm sure he feels pretty similar.
Yeah,
Anyway,
he does. And as a matter of fact, I was just talking to a coworker today. Now it's snowing here in Michigan. It's extremely cold. It's 14 right now outside. But I was talking to a coworker and we made a deal today. We're like, hey, once winter's over, every day we're walking at lunch. We're going to try to put in 2 miles of walking, her and I, and we're going to try to get a group together because we both know it's simple. And if we can help each other not skip days, because it's always easy to skip them and quit.
it sure is.
So I'm looking forward to doing that to help my overall health, help my heart, you know, do as much as I can to, never, is what I hope, end up on dialysis.
Yep. And sleep pattern's good too. It's important to have good sleep and all those things. So yeah, there's all these things we can do that are simple, that can make a difference, that can make a real difference.
Yep.
But
Now, would you like to answer any questions from the audience?
yeah,
We've got some questions here. Let me go back. There are so many of them. People are loving it, first of all. Let me tell you that. We got a lot of people saying, like, here, thank you for your openness and honesty. I appreciate your compassion for others. This is one of our regulars here on Dadvice TV. Annette said, thank you very much.
thank you, Annette.
We got here. This information is so helpful. Thank you. Another, thank you so much for the helpful information in this video. Look at this. This is just fantastic. Someone did ask, hey, where can they get Renadyl? And I'm going to come back to the screen where it's just you, because we have a QR code up there in the corner. If anyone is interested in learning more about Renadyl, you want to learn more about Dr. Rick, you want to learn a little more about probiotics, how they work and all that, scan that QR code and it will take you to a landing page with all sorts of great information. You could also order Renadyl there if you'd like to. If you want to type in the URL, I'm going to add it after the call is done, after our broadcast is done, to the video description. And this is, someone said, what probiotic do you take? I take Renadyl. This was recommended to me by my renal dietitian shortly after being diagnosed. I asked my doctor about it. He was actually familiar with it, said, yeah, this is good, but also eat some high fiber food. He talked a lot about diet. And this has been something that has been part of my ongoing treatment strategy as I went from a single digit GFR. When I was diagnosed, I was GFR 8, and I slowly got up to 13. I remember 17, 19, the low 20s. The highest I hit over the last 7 or so years has been 33. It fluctuates between the high 20s and 33-ish. I'm getting labs probably next week. Yeah. I'm due for labs, but I've been a bad boy, and I've been eating some sugar, and so I'm like, I want my A1C to be as low as possible, and I know I can't lower it quickly, but I'm like, I'm eating very good, and probably next week I'll go get updated labs, and I just want to make sure my A1C stays below pre-diabetic. But anyway, this URL here, or the QR code will take you to the landing page. You guys can go to the URL go.dadvicetv.com/probiotic, and that will also take you directly to that landing page. But after we're done with this broadcast, I'm going to put it in the description so you guys can scroll down and see. Because I know most people like to come back. It's hard to take notes. So they like to watch videos multiple times. So when you guys come back later, or if you're not watching the live one, it's going to be in the show notes on how to get it. And I've been taking it. Someone says, can you take it on an empty stomach? So I take my 2 tablets in the morning on an empty stomach. I avoid breakfast, not for any real reason, except I like to sleep in. And I got a lot of traffic and a long 35-minute drive to Dearborn, Michigan for work. Um, and I take it, no problems. When I first started taking it, I did get a little bit of the toots. It could make you a little gaseous for some people, but that went away really quickly. And people I've talked to have said, hey, I don't have that problem. Um, let's see. Let me look on here. So here's Paula. She just said, I've been on hemodialysis for the past 8 years. Wow, Paula. That is, I know how difficult that probably is. Or I don't know. I can imagine how difficult that has been challenging. Do you ship Renadyl outside of the USA? So she's on hemodialysis. Is Renadyl a probiotic that she should be considering if she's on dialysis?
I think so, because it can block inflammation and it can do all these things that can probably help overall health. But it's not like it's absolutely proven. But I think that she could take it and see, how she feels with it, and make a decision based upon her own personal experience.
Yeah. Now I'm not sure if they ship it outside of the U.S., Paula, but
I
we
don't
have
know.
someone. We have someone watching. His name is Mike. Mike, if you are watching still, can you type in the chat on YouTube if this does ship outside the USA? Mike is extremely
Mysterious
familiar
Mike.
with it.
Mysterious
Yes,
Mike.
yes. We'll wait for him. Now here's a great one. Andre says, "Is this the same bacteria we get with sauerkraut?"
I don't think so. Whoa, that's a great question, but it's one I've never thought of. But again, maybe Mike would know, but I don't think so.
This one, I do know the answer to that one. The answer is no. There's so many bacteria out there, and Renadyl, these are ones that have specifically shown that they help the things that we kidney patients have challenges with. And I enjoy sauerkraut. I eat it from time to time. I used to think it was awful until I tried it warm, and I was like, "Whoa, I've been missing this." So I'll
Oh,
occasionally have some. Someone says sauerkraut is way too salty. I never eat too much of it, so I don't really have to worry too much about the salt in it.
James, I have a story to tell you. My older
Yep.
brother, when I was a kid, took some sauerkraut and poured off the juice, put it in a glass, and put it in the refrigerator so that it looked like lemonade. And then he
Oh,
went and asked me to play him outside. We were playing and it was hot.
yeah.
And he said, "Hey, Rick, I made some lemonade." And I was so thirsty, I guzzled it. And ever since then, I'm not a sauerkraut fan.
Oh,
It was so anyway. So bottom line is, I don't know anything about sauerkraut and its bacteria, but I'm glad you could answer that. But anyway,
yeah. So I had a similar story with sour cream. I thought it was Cool Whip, and I was making an ice cream sundae at a buffet, and I went crazy with the Cool Whip, and it was sour cream.
oh gosh.
Wisconsin grandma says she agrees. She's also scared to death to go on dialysis, so she'll do anything she has to avoid dialysis. That's what motivated me to make all the changes I had to make to give up soda, to start eating better. And when I was first diagnosed, let me tell you, my diet was amazing. I I ate only what the dietitian said. I was weighing my food. I wish I had the fear in me again to be able to do that constantly. Now I've gotten so comfortable, but I've gotten much better. Today at work we had quite a buffet at our event, which is at a big hotel, and I was enjoying it. I was like, hey, this is all good stuff. There was some cannolis. I
Gotta
was like,
take double Renadyl a day.
yeah. I saw some cannolis. I was like, oh, I love cannolis. I was like, I have not had a cannoli in probably 5 years. So I had one.
I won't tell.
Yeah.
No one's listening.
Now, let me just go back here because we are getting to the top of the hour and see what other questions we have in here. And I don't know if you can see the questions on your side. There's a button there to see them, and you could scroll through and see if there's any you would like um, to answer. I'm seeing so many thank yous for this. This is the first time we've really had a nephrologist talk
Oh,
about
there's
probiotics.
a question. Do you
Yep.
think that once you're on dialysis that you can ever come off of it? And there are first off, if you have what's called acute kidney injury, which is what we talked about, that's a temporary kidney failure that can last 2 to 3, 4 months. And so, if you have what we call acute kidney injury, there is a fairly significant chance of recovery. It's greater than probably 80% chance or more that you're going to recover. But there is also a rare situation where people can be on dialysis for a year or two and then come off. And
Mm.
um, it's seen with certain diseases more than others, like a malignant hypertension or like really severe kidney failure associated with pregnancy, or so there this thing called hemolytic uremic syndrome, which is what you get from E. coli. Oh, it's from a bad bacteria, E. coli
Yeah.
0157. The one that causes bloody diarrhea and then causes kidney failure. They talk about it all the time because there's outbreaks of this stuff. So there are these types of kidney failure where you can be on dialysis for anywhere from 3 to 15 months, 18 months, and come off. But in general, it's very hard to come off dialysis. But we have kidney transplant, and I really
Hmm.
recommend everyone to talk to their doctor about the possibility of getting a kidney transplant if your kidney function's really bad. They'll even do transplants if your kidney function's really bad and you're not yet on dialysis. Sometimes they can do it. And but what you did, James, going from a GFR of 8 to 30 or 32,
Yep, to
hey,
33.
let me tell you something. You're the star today. That's, and so you were doing a lot of good things. And I'm heartened to hear, how you were following the diets and doing all this stuff and taking Renadyl and seeing that improvement in kidney function. That's really incredible.
Yeah, it was the fear of dialysis, and I'm a super nerd. I love to interview people, as you can tell. I'm a talker, and I went and I thought I'm gonna go talk to people in dialysis. What worked for them? What did they do wrong so that I don't do that? And that fear is what kept me focused on do whatever I could to get healthy. Now, I believe now looking back that I had undiagnosed CKD, which I have CKD today. And I believe I probably had an AKI on top of that, which pushed me too low. Um,
Yeah.
I, thinking back, I remember just how awful it was feeling. I had like every symptom: the cough, the headache, unable sleep, the chills, my teeth would chatter. I was so weak getting up out of my bed, just walking to the bathroom. I'm holding onto the wall, breathing really hard. It was
Yeah.
just so difficult.
That's
But I am so happy, and I still do what I can to try to avoid it. Now, here's another question I'd like to try to get in real quick. Anne asked earlier, does leaky gut cause acid reflux?
No, they are distinct. They're distinct from each other. So reflux is typically if you get a little bit overweight. It's more common when you get a little bit overweight, and you've got a little bit of extra fat in the abdomen. That's typically when reflux really can manifest. When I gain weight, there's a specific weight where I'll start getting reflux, and if I can lower my weight, my reflux goes away. And so reflux is where there's the entrance of the esophagus into the stomach. It doesn't close correctly, And so food, when you fill up the stomach, it will kind of reflux up and can
Yep.
cause heartburn and terrible things. And it's usually worse if you eat right before you go to bed, because then the stomach gets really full, and then you lie down, and it's easier for the food to kind of to reflux in the supine position. But the diets that can cause reflux are also diets that can cause leaky gut. So diets like high in sugar,
Mm-hmm.
sugar causes leaky gut, and sugar can cause obesity. And so, they're connected, but they're not causally linked. It's related more to the diet and gaining weight.
Yep. Now, some information I want to share with everybody out there. Um, I just learned that yes, Renadyl does ship outside of the US. So boom, great thumbs up there. And Teresa shared a personal story. Her husband, who's 87 years old. Oh, Teresa, I can't. I hope I make it to 87, and I'm still my active, outgoing self. Says he has been taking Renadyl for several years. His nephrologist seems surprised that he doesn't have severe symptoms with his GFR of 15. Hey, that is fantastic. Managing those symptoms is so important. As someone who has kidney problems and has had those symptoms, let me tell you, especially anemia, once I got past those, I felt like I got my life back. I felt like, holy cow, I'm never going to get to that point again. So managing the symptoms is really, really important. All right, Doc. Do you want to answer one more, or we're at the top of the
Yeah,
hour?
we can do one last one.
Okay. Is there one that you would like to answer that's in here?
No, you go ahead and surprise me.
All right. So, oh, someone that said, "Are you speaking of Renadyl?" Yes, we are talking about Renadyl. And we're talking about gut health. Make sure, Christina, go back to the beginning. And there's so much great information Dr. Rick shared. I even learned a lot during this call. Okay, viral Fakil, and I'm sorry if I mispronounced the second part of his name. I've seen him on here before, so he's a regular. He asked the ratio of the bacteria that are in Renadyl. Does the ratio matter? Is it useful what the ratio is for the different bacterias in there?
For in the gut, that ratio of firmicutes and bacteroides it is important in driving, associating with the obesity and metabolic syndrome, and so yes, and I believe it's the bacteroides you want to increase, but I would have to cross check myself. But yes, but what Renadyl is, it's not really picking a specific firmicutes and bacteroides. It's as a family, it's picking things like lactobacillus and bifidobacterium and bacteria that we know can really provide really good health. Um, they're specific bacteria that have been tested and yes, the overall families are what you say is correct, but bacteroides themselves don't carry such good things as like a lactobacillus does. And a lactobacillus can, for example, there's certain lactobacillus species that will degrade uric acid, which is one of my interests. There's another one that works on other things like urea, but the bacteria in Renadyl are distinct from the bacteroides and firmicutes.
Perfect. All right, Doc. Thank you so much. This has been such a wonderful conversation. I've learned a lot, which I love learning because the more we know, the better choices we can make to help us live as long as possible, uh, delay that need for dialysis, maybe even push it off forever. That's what I'm hoping for. Or if I ever do need it, I pushed it off so long that they're implanting pig kidneys with no problems or something like that. And it's easy to go get a transplant that'll work great. This has been fantastic. I'm going to bring the QR code back up right up here. For those of you watching, that QR code, scan it with your phone. It'll take you to a page where you can learn more about probiotics, about Renadyl, about Dr. Rick. Lots of great stuff. Someone said, come back, Dr. Rick. Dr. Rick is definitely invited again. I'm sure he will be back. This is talking to you is a lot like talking to Dr. Rowe. I have a ton of fun. And you know, it's fantastic to have a great positive conversation. All right, everybody.
Go Kidney Warriors.
Yeah. All right, everybody. I will be back in 2 days on Thursday with Dr. Rosansky. So set your time, 7 p.m. Eastern Pacific, 7 p.m. Eastern time. I used to live on the other coast. This Thursday, Dr. Rosansky will be here. Thank you so much, Dr. Rick. This has been wonderful. And everyone else, I'll see you all in the next video. Bye, everyone.